Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Because we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We're not only going to give out positive vibes to people today if they like us on Facebook, but we're also going to, we want positive vibes to us. We want to make sure our mics
you
are
want
gonna
it
work
both
today.
ways.
Yeah.
Yeah, I get it.
We're going to talk about easy exercises for knee pain, 4 easy steps to remedy your pain.
Sure.
Before we do that, if you are new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. And as we were just mentioning, if you go over to Facebook and like us, Bob and Brad, flip it, baby. All right. Bob and Brad, we're going to send you some positive vibes, and we could use some ourselves. So let's get it going both ways. So, all right, Brad, you're going to run the show today, right?
Absolutely. Oh, let's get going. So knee pain. Oftentimes, knee pain that you have for a long period of time hurts more when weight bearing is very common.
It's stairs, hills.
Yep. It's either
going downstairs.
It's typically in the joint, between the tibia and the femur, or right into the kneecap, which a lot of people aren't aware of, that the kneecap.
Yeah, the kneecap can be a culprit, and you don't realize it. Quite often I see that. They think it's in the joint, and it's underneath the kneecap itself.
The bottom of the kneecap literally is a joint to the other part of the knee. So first of all, let's look at the big picture. You want to look at your range of motion. And as a therapist, that's one of our first things we do. Does the knee fully extend? Does it go all the way straight? And then you want to see if it flexes all the way. Oftentimes, it's the fully straightening that can be the problem. But it can be bending
I see both.
too.
My wife has it. She has trouble bending hers.
Bending too?
Yep, she works on that all the time.
Okay.
And what you have to do is you got to compare one to the other.
Sure.
Unless you have 2 bad ones, which is possible.
Right.
But we want to show how to compare extension, Brad.
Sure. So now you can do this on the floor like this. I'm seated on the floor, but let's say this is my good knee and it goes all the way down. You can see I got normal extension or straightness, if you want to call it that. But this one, if you look at it, it's stuck right there. And that's a painful one, and that extra little bit is a little uncomfortable. So that's where we're going to try and get a little extra extension.
Yeah, even if it's a slight amount, you do want to correct it.
Yep.
Because what they have found is that even correcting slight amounts can greatly reduce your pain. It's the same with flexion. So, I mean, the other way you can measure it is laying down like this. So I'm going to measure this one. I'll pull it up, and a lot of times you can just tell by the feel too.
Right.
Brad, like they'll go, oh, this one, that's tighter. I can feel.
Yep.
And this is one way you can stretch it too, by the way.
Sure.
So you're going to want to stretch into extension if you're lacking that, and you're going to want to stretch into flexion if you're lacking that.
All right. So flexion is bending. Now, how far does it bend? You know, they both should be equal, and typically, you know, for most people, you can get your heel pretty close to your buttocks. So that's the first thing you do. Work on the extension and flexion, and then number 2. Let's keep the joint moving.
Right.
Very
important.
Once you get full range, and keep in mind that if you're not getting full extension, not getting it straight, you may not get it straight for up to a week or even more.
Oh, it could take a while.
You can work on it a little bit each day. But in the meantime, we want to keep that knee moving, and oftentimes it's more comfortable non-weight bearing. And if that's the case, a good option. Can you grab that towel there, Bob?
Sure.
You know, if you're at home, you got a smooth floor, you can take a towel and put it on the floor. And, you know, this is real common for total knee replacement. And you get some motion in that knee, just scrubbing the floor. That works okay. The next step better is if you get a nice device like this. This is called a knee glide. And this way you don't have to have a smooth floor. You can put it on carpet, you can put it on any surface, and you got a real nice surface to work with.
The other thing I found about the knee glide, Brad, is that a lot of people, you know, to do a towel, it's really not comfortable for them.
Yep.
But as soon as you get this angle up here, my wife, when she was having knee pain, she couldn't do it flat. It was just too hard on her ankle or something. But this puts you at a better angle.
Right.
And yeah, it's a strange phenomenon. I mean, I guess it makes sense to some extent, especially when you have arthritis. The more motion you get in there, the more lubrication you get in the joint, basically.
Right. Yep.
The synovial fluid builds up, and
you get that fluid, then there's nutrients that go along with that.
More blood flow. Mm-hmm. So you want movement. You don't necessarily want movement with weight bearing. That's why sometimes this is nice. We have a lady right now, Brad, that actually takes 2 of these in her room, and she just
One on each.
Yeah,
one
and
for each leg.
she works
Yep,
both legs,
yep.
and it's really helped her knees. I was really
Sure.
surprised, and she understood that concept really well.
Right, because
So-
it works for her. So you can see I just turned it around, and that actually
Yeah, now
changes,
it's
gets
working-
more hamstring.
Working the hamstring,
Yep.
right?
And you can do it laying down. Why don't you lay down, Bob?
Sure.
And why don't you take your shoe off? It probably will be better with the shoe off.
I'll put it on there. I can put it on with a shoe on.
It's not as good, Bob. You got the corner of the heel there.
That's why I like it.
Oh, you do?
Yeah, I like
Okay.
it's easy on my heel.
Well, that's a good point. If you're laying in bed and you don't have your shoe on, you can take a towel.
Right. Now I'll take my shoe off.
Okay, then
Now
it
that
is
you-
a little more comfortable.
Now that you got me some comfort, I can work on.
But this works really nice for those people who, they may be after surgery
Right.
or they're ill and you want to get some movement on their legs and you're in bed and dragging your foot across the sheet is really
not work.
Yeah, this
No.
works much better for that type
It's a
of
great way to
thing.
start off. All right, and so again, it tends to be better. I mean, another thing you can do is bike. If you bike, you're getting motion
Right.
along with non-weight bearing.
Yep, some
So-
stationary biking or
Yeah.
outside. If you're going to use something like this, that motion, usually 2 to 3 minutes. You can go up to 5
Yeah.
minutes. You'll know when you get tired. It's more tiring than it looks.
Yeah.
Particularly if you're having some knee problems.
I
Okay.
concur.
Bob concurs. Say no more.
All right, well, we're on number 3 now,
Bob,
Brad.
I thought this was my show at the beginning. You
Oh.
said- he did say that, didn't he?
I'm trying to keep things moving.
All right. So we want to use heat or cold.
Oh, I thought you were gonna-
Oftentimes, if you have a swollen knee and it's painful, I'm going to probably say a cold pack.
All right.
Why don't you grab that cold pack? And my favorite cold pack is this one right here. This one is from Salmon's Preston. And the reason why it's my favorite one, and I've had patients say, I want this. They go online, they buy it. It wraps around the knee, and it's got nice Velcro straps. It's got nice, soft, cushy, fuzzy material on the outside. And
It kind of conforms to the knee,
right.
doesn't it?
Yeah, you can do this laying in bed. You can do it in a recliner, works well. Even in a chair like this is
You want to
is
be a
nice.
little careful over the kneecap. There's not a lot of soft tissue there,
Yep.
so you can get actually frostbite.
Well, you never want to put it directly on your skin
Yeah, right.
because there is a little material in here, but if you put it over clothing, you're probably going to be good. Yeah, like right here is my kneecap, so you can have it.
You can kind of have a gap there
Yep,
for the
yep,
kneecap.
that's a good
So,
point, Bob.
so.
So again, 15 minutes typically with a cold pack. Cold pack is the type of thing when it's on, initially it feels a little cold, but then it should feel good. And after 15 minutes and you take it off, should continue to feel good for a couple hours. If
now-
it doesn't feel good and it just is driving you nuts, don't use the cold
Right,
pack.
and a lot of people who have arthritis don't like cold.
Right.
I mean, they like the heat, and a lot of times the heat feels better.
Right.
We got here, what we prefer for that is the infrared Thermotex. This is actually the Platinum model. It's got 3 panels. And what's nice about infrared, as opposed to regular heat, it actually penetrates much deeper.
Right.
Regular heat only goes like a millimeter or a couple millimeters.
Just skin deep is about
yeah,
it.
and this goes
2.36, over 2 inches, and if you put it around the whole knee, you're going to get the majority, unless you really have a large knee, but you're going to get really nice heat.
Yeah, so what he's saying is because it's got 3 panels here, this panel is going to go 2.36 inches, and so is this one.
Right.
It's going to penetrate all the way through the knee joint. And how often can you do something like that? So,
Right.
I mean,
See how it conforms all the way around? It's got Velcro straps that you can...
it's got a lot of straps because the Platinum one can be used for your neck, your back, and you use the straps in different manners
Right.
for doing that. So
you get that on there, and you've really got a nice, deep heat.
it is very pricey.
Right.
But this is something that, like an investment, if you're having pain in multiple areas, it works really well.
You bet. Yeah, it's going to last a long time. They're built very well.
You have to be careful with these, though. You could burn yourself on a knee.
Right. So you don't want to. You could just have some cloth there as well before you put that on.
Right.
Or a towel.
And don't have it on too long. Don't fall asleep with it on or
Right.
anything like that.
They
So-
recommend 45 minutes. Is that correct?
Right.
Yep.
Right.
So again, the Thermotex infrared. If you just get a conventional hot pad, like Bob said, it's just going to go skin deep. It'll feel warm, but it will not get into the joint.
Right.
And then fourthly,
if that's such a word.
Yeah. This is pretty simple. You just, with the kneecap, just assess, put your leg out straight, relax your quadriceps, relax.
By the way, I got to point out, Brad's got a tan.
Yeah, look at that. Here, let's see.
So,
Yep, even under my socks, I was not
you
tanning
said
with
earlier
my
that it was only one leg that you tanned, though.
Well, it's for the video.
Yeah, for the video, you just tanned the one
Yeah,
leg.
this one's still white.
Okay.
Anyway, so yeah, look at that kneecap, relax the quads, see if that kneecap moves up and down freely, right to left. And if it's a little tight, you can work it. And if it's a little painful, and as you work it more, if it feels better, you know you're doing a good thing. If it just gets irritated, the more you mobilize it, then you better back off of it. You might just be overdoing it.
What you may find, especially if it's tight in one direction, it's actually the kneecap is not tracking right then.
Sure, right.
So by stretching it, you might help it track better,
Yep.
go along in its canal better, and there'll be less rubbing and irritation underneath the kneecap. So it's definitely something we have people do, especially when they have patellofemoral syndrome.
Right. Oftentimes, it's the tissues on the outside of the knee are the tight ones. So
Right.
pushing it in this way is the key to getting
pushing
that.
it toward the other knee.
There you go.
Quite often.
Yep.
So no matter which knee you're on,
Yep.
quite often it's tight going towards the other knee.
And some people, I was never aware a kneecap moves so freely until you really.
Well, if it's loose. I mean,
yeah.
some people it doesn't move that freely. So.
But you really have to relax the quads.
Yeah, you do. You have to trust that, because a lot of people think it's an icky feeling. So
That's what I've heard. Yep.
Yeah.
That's a good way.
All right, Brad. Well, thanks for running the show today. I thought you did a fine job.
Well, I did my best. I got extra sleep last night,
All right, good to hear. Thanks for watching.